Becoming a Care Coordinator, State of Alaska, Medicaid, Home and Community-Based Waiver, and Community First Choice. This is a presentation from Training for Senior and Disability Services, State of Alaska Department of Health. How do I become a care coordinator? All care coordinators work for a care coordination agency. The care coordination agency cannot also provide other waiver or personal care assistance services. If you are currently working as a direct service professional, a personal care assistant, or a case manager, you will need to stop doing those jobs when you are certified as a care coordinator. A certified care coordinator cannot provide other waiver or personal care services after being certified. So what do care coordinators do? Here are some basics. Alaskans can get help from many sources, such as doctors or other medical staff, family, friends, school, work, and people can do some things for themselves. A care coordinator provides a service in the Medicaid, home, and community-based waiver program. Care coordinators help Alaskans of any age who have significant disabilities. The person could be a frail elder, they need to have Medicaid, and show that they need the kind of help that people get in a nursing home or an intermediate care facility. Because the people have Medicaid and are choosing the home and community-based waiver, these Alaskans have chosen to get their help at home and in the community instead of entering a nursing facility or intermediate care facility. The care coordinator makes their person-centered support plan that tells what services or help they need for everyday living and being involved in their community. This is part of our person-centered care coordination course, so if you're viewing it within that, that's great. If you're viewing it just on YouTube and you're interested in becoming a care coordinator, you can contact us at sdstraining@alaska.gov for more information about our person-centered care coordination course. Care coordinators do the following things. Every 6 months, a care coordinator will visit the Alaskan face-to-face at home and in a service environment. That means a place where they're getting a home and community-based waiver service. A care coordinator does 2 phone calls or possibly video chat with the Alaskan or their legal representative every month, depending on the waiver type and need. The care coordinator visits and makes contacts with providers who are doing services too. They help the person get access to other services. The care coordinator arranges meetings to plan services. They keep track of many deadlines. The care coordinator submits documents on time per regulation. And a care coordinator can expect to write many notes for the service they provide. They keep their training current, get recertified as a care coordinator and or an agency providing care coordination, and they have a backup care coordinator. Care coordinators visit the Alaskan, but what else do they do? You may be asking yourself, what hours do I work? What can I expect? What experience and education is required? What training is there that I need to do? What technical skills do I need? How about people skills? What do I get paid and how do I get paid? How long does it take and how can I get started? A good document to read would be Provider Conditions of Participation. It's available on Senior and Disability Services website in the Regulations section. It's called Provider Conditions of Participation. We have a code here that you can scan if that's convenient. Otherwise, just continue on with our training and we can give you more resources at the end. And another great document that you should read is Care Coordinator Conditions of Participation. That is another set of requirements for care coordinators, which includes education and experience, basically the things that we're summarizing in this presentation here. If it's convenient, you can scan the code to go see the document. Otherwise, we'll be summarizing it for you in this presentation, and we'll have resources for you within our training should you be pursuing care coordinator training. So there are two levels of care coordination. One would be to work for a care coordination agency. So you become a care coordinator working in a care coordinator agency, and that is an agency that is certified and enrolled with State of Alaska Medicaid and Senior and Disability Services to provide the waiver service of care coordination. And the other one is to be the administrator of a care coordination agency. A care coordinator administrator must also be a care coordinator, and you could either work for an agency that's already existing, or you could apply to become your own agency of one. So sole proprietorship. An agency that has only one care coordinator is called sole proprietor care coordinator. One employee who is both owner of the business and the care coordinator that works in the business, and they're the care coordinator administrator. Care coordination agency could have only one care coordinator or many, but they can only provide the service of care coordination. Let's think about what education and experience is required to be a care coordinator. The basics include a care coordinator must be 18 years of age or older. An administrative care coordinator must be 21 or older, and all care coordinators must pass the Alaska background check and nationwide background check, which covers Medicaid services overall throughout the nation. A care coordinator administrator qualifications, not only is it being age 21 or older, you need to have a 2 or 4 year degree, social work, the psychology fields, rehabilitation, nursing, or other closely related field, human services fields only. Or you could have 2 years course credit in the above and 2 years full-time or equivalent part-time work with people in services. Or you could have 4 years of full-time or part-time work, equivalent part-time work with people in services. Or you could be certified as a rural community health aide or practitioner within the last year, full-time or equivalent part-time work. At least 1 year of supervisory experience is required involving program and or service planning. Education and experience includes a 4 or 2 year degree in the human services field and 1 year of full-time or equivalent part-time work working with people in services, or 2 years course credit in the above and 1 year full-time or equivalent part-time work working with people in services, or 3 years full-time or equivalent part-time work with people in services, or you are certified as a rural community health aide or practitioner with 1 year full-time or equivalent part-time work. Understanding the difference between human services and human resources. They are different things. They are not the same. Human services fields have to do with helping people, the helping fields. Human resources is about management of people within jobs. So human services is what we're looking for as a background for a care coordinator. This is a list of very common human services fields. You would need to have the required education and experience in these rather than other fields or human resources. And here are more things you need to know or learn before becoming a care coordinator. What help Alaskans need for behavioral, medical, or rehabilitative conditions, the laws and policies of senior and disability services and Medicaid, common human services terms, and the steps to become certified as a care coordinator. Care coordinator training. You would start with basic concepts of care coordination with the Alaska Training Cooperative, which is underneath University of Alaska. There's a $35 tuition fee for that one-time class. If you are by chance applying to become a care coordinator again after having not been a care coordinator for a year or more, you will have to take that class again. But it is only required one time before you put together your application packet for certification. You would then complete beginning care coordination training with Senior and Disability Services Training Academy. There is no cost to our courses in the Training Academy. You would study critical incident reporting training, settings training, mandatory reporting training, and then you would also study our learning units for beginning care coordination within the Training Academy, and you would take the exam, and you would need to pass at 80% or higher. So all of these trainings need to be completed within 1 year before you apply for certification. Also, you would be taking your 16 hours of continuing education, which is education that will enhance your practice as a care coordinator each year. Here's a QR code if it is convenient for you to scan to get to the Alaska Training Cooperative registration page, and that is where you can find in their course listing basic concepts of care coordination. Next, you would prepare an application to apply for certification with Senior and Disability Services. So for certification as a care coordinator, you would prepare your packet and give it to the admin care coordinator at the agency you will work for, who will then give this to provider certification at Senior and Disability Services. Every care coordinator needs to work for a certified enrolled agency. There is no care coordination just outside of being with an agency. If you're going to be both an administrator and owner of a care coordination agency and a care coordinator, meaning the sole proprietorship, you would certify for a care coordinator at an administrator or agency, completing an application with required attachments, and give it to SDS certification unit. Then you would enroll separately for your care coordination agency with Alaska Medicaid's fiscal agent. That is done through Medicaid, www.medicaidalaska.com. And you can use that as a resource to find out more about becoming enrolled as a provider. The initial enrollment fee is about $700 and it is subject to change, and that is paid to Alaska Medicaid for the actual enrollment as a billing Medicaid provider. They will also provide you with additional classes and training on how to bill Medicaid, and you can connect with their online billing system. And you can find these resources at www.medicaidalaska.com. And there are many pages there that are for new providers or beginning providers. Each prospective care coordinator in agency must prepare a certification application packet. So all agencies will have packets that they send in to Senior and Disability Services, and they're composed of documents that you prepare or provide and some state forms that you will fill out. They are all available on our website. And the state forms are listed by category and number on the website, cert and then number. So you would look under certification forms. And we'll talk about that more in the next few slides. So scannable code for the Senior Disability Services Forms page. The Care Coordination Agency Certification Application Packet. This is required for all care coordination agencies. Now the yellow one is the provider certification application, and that is a form that you would find on our website. So that is not a form that you would create or get from another place. That's a state form. You also need to provide a State of Alaska current business license, a certificate of insurance which names SDS as a certificate holder. We recommend that you discuss the specifics of that with your insurance agent as you develop your business. You'll need to create an organizational chart with personnel names as many as you can. And if you don't have names, then you can put vacant positions if this applies to you. And then also a personnel list if they're not all on the org chart, which is not required if you're applying to become a sole proprietorship. And here's some more information about the Care Coordination Agency Certification Application Packet. Again, the yellow forms are state forms. So you need Cert 06 Service Declaration for a care coordinator, Cert 37 Policy Assurances Form, Cert 04 Notice of Appointment or Change of Program Administrator, Cert 46 Care Coordination Agency Certification of Conflict of Interest Attestation, and then some documents that you would develop or get. One of them is the results of your background check. You need to develop a policy for critical incident reporting. You need to develop a quality improvement policy in which you address what is your grievance procedure and how do you improve services that you do. And a termination of services policy, which tells how you terminate services to people that you are being a care coordinator for when you will no longer be their care coordinator. Forms that you develop. The policies that you have must be written by you or an authorized agency representative. You must follow your own policies and procedures on an ongoing basis. A policy tells what you will do, a procedure tells how you will do it. So you have one here for person-centered practice. How do you assure that you will accomplish person-centered practice? Financial accountability. What generally accepted accounting system are you using? Independence and inclusion policy. How does your agency provide person-centered service? A training policy, which tells how you will do training for your agency, and a termination of provider services policy and procedure. How will you comply when ending services to clients? Here's a packet list for a sole proprietor. So let's take a look at the yellow documents first. If you are already certified and opening your own agency, rather than working for a care coordination agency, you're going to establish your own. You would complete Change of Status Care Coordination, Cert 44. If you are a new care coordinator, starting an agency, not coming from a previous certification, you would fill out Cert 02 Care Coordinator Certification Application. You would fill out Cert 20 Disclosure of Business and Familial Relationships. And the other yellow form is Cert 03 Worker Assurances for a Sole Proprietor. Okay, so our previous slides, we talked about Cert 06, a service declaration for care coordinator, and that is also required in this packet. Cert 04, notice of appointment and change of program administrator is required. And we need your current resume. And for educational transcripts or experience proof, unofficial copies are okay. A lot of times the transcripts cost money. If they're official copies, unofficial ones will do, but it must be verifiable. With more than one care coordinator, you'll have a few documents here on hand. Your policies need to be written by an authorized agency representative, and you need to follow them, your policies and procedures ongoing. These are, what you're putting in your certification packet, and this is what you're telling the state that you're going to be doing as a business. So you'll be expected to follow it. So your background check policy and procedure, how will you comply with background checking for your employee care coordinators? Emergency response policy and procedure, how will you keep data and people safe in the event of an emergency that either threatens data loss, and then just in the event of a threat to people's health and safety, what would you do? What is your policy? Evaluation of employees, policy and procedure. How will you evaluate the performance of your care coordinators? And the training policy and procedure. How will you comply with training requirements? If an agency hires a new care coordinator and they want to have them certified, which is required, then what they'll do is turn in a packet that looks like this. Cert 01, a care coordinator application. That is a form on our website. And Cert 20, disclosure of business and familial relationships form, also from our website. They'll submit the resume, current resume of that care coordinator, and documentation of education and experience for that care coordinator. The administrator, care coordinator for the agency will turn this into senior disability services when they have a new care coordinator working at that agency. So what trainings are required for all care coordinators? One time only, home and community-based settings, mandatory reporting, critical incident reporting needs to be renewed every 2 years, and care coordinator training completion is renewed every 2 years. And this is going to be either beginning or renewal care coordination. For all of these, they can't be older than 1 year before the first certification application comes in. And these are available through our SDS Training Academy online. And what about continuing education? We call it CEH, continuing education hours. These are required for all care coordinators, 16 hours per year. So this could be in-services, could be college courses, could be courses through the SDS Training Academy. Some of them are CEH, could be through Alaska Training Cooperative, and more. You need to follow your agency's training policy and plan for continuing education hours for your care coordinators or for yourself. If you do in-services or other trainings, you would need to follow the care coordinator conditions of participation for requirements around an in-house training like that. That's another reason why the document is so important. But basically, just for this presentation, just know that CEH is required. Some helpful hints. Turn in a complete application, not one document at a time. The team does not collate your documents for you. You need to turn in everything you have at once. Fill out all the state forms completely. We greatly prefer that you send them as an attachment to an email to dsdscertification@alaska.gov. You may drop off or mail paper documents to SDS Certification, 1835 Bragaw Avenue, Suite 350, Anchorage, Alaska, 99508. Again, we strongly recommend that you email them to us. If you are working with paper documents, don't put them in a binder or staple them. Leave them loose and put them in order. You could make a table of contents and put them in one large envelope and mail them to us if you happen to be working with paper documents. What happens after you submit the application? SDS reviews it, and you'll get a notice, a letter if it is approved. And if you need to turn in more information, it'll also tell you that, or if you are denied. If you are denied, you may appeal that denial, and you need to set aside 3 to 6 months for the entire process. It just does take quite a bit of time to certify and enroll and have those two things happen in order to be able to take customers, if you will. Enrollment in Alaska Medicaid with the fiscal agent. So MedicaidAlaska.com is where you will apply for enrollment as a Medicaid provider. Care coordinator administrators will attend training with Alaska's Medicaid fiscal agent. You would learn how to bill Medicaid for reimbursement, how to comply with HIPAA, the Health Insurance Portability and Accountability Act of 1996. All information about your clients is protected health information and subject to protection under HIPAA law. And you would also learn your other responsibilities as a billing provider. What skills do I need to be a care coordinator? You need to learn how to write a comprehensive clinical note. You need to have some computer skills. You need to have a professional email address. You need to know why and how to use different web browsers. You need to be able to use websites that have usernames and passwords. You need to know how to get computer and software updates. You need to have a file protocol so you can access records fast and have a compliant records retention protocol in place. This means that you will keep all records HIPAA compliant for 7 years from the date of service to the person, so paper and digital both. You will keep those records compliant. You'll make sure your computer fits the requirements for the SDS Harmony website, and that is your data website that you'll go to that the state opens to care coordinators so they could work with caseload files in it. And some other skills that you need to be a care coordinator or administrative care coordinator. You need to know how to write and follow your written policy and procedure. You need to know business accounting, whether it's done by you or someone else. That's okay. You can have an agency do it, but you need to know about it and know that. You need to know how to comply with regulations like Medicaid, business laws, and other laws like zoning, where your business is, business and professional licensing, if that is included in your application packet. You need to be keeping those current. For example, if you're a social worker, then you need to keep that current if that has been part of your application packet to SDS as education and experience to become a care coordinator. You need to know how to have insurance for your business, and we direct you to your insurance agent for that. And you need to know how to comply with tax law, and we do ask you to ask your tax professional about that. Here are some common questions. I never wrote a policy or procedure before or an employee handbook. Are there templates for that? No, there are not templates. You must submit your own work. You must still show evidence that you know about and are following your policies, even if someone else writes them for you. With the business part, do you teach that? No. Here's a resource, though. The Alaska Small Business Development Center is familiar with care coordination as a profession, and you would be free to ask for their assistance on the business development part. So what do I get paid? How do I get paid? A care coordination agency requests reimbursement from Medicaid after the service is done and documented. Because care coordination is a monthly unit of service, if you will, its billing can go out the following month after the service is done. Reimbursement rates are determined by the State of Alaska Office of Rate Review. Medicaid reimburses the care coordination agency, including a sole proprietor agency. An agency with multiple care coordinators pays them per their agency structure. In other words, as a care coordinator working within an agency, you would be paid wages by that agency. So all reimbursement requests to Medicaid are known as a fee for service. This means it's requested after the service is done. And so a service is done, you need to complete all notes and documentation and store them per HIPAA law. You need to use correct procedure codes, and you need to remain certified, enrolled, and in good standing as a care coordinator. The Alaskan you serve must remain eligible for Medicaid and have an approved current level of care. We do have a separate course just on documentation, so we highly recommend that you check that one out and complete that course too. Here we are showing current rates as of January 2024. Rates are subject to change. So we're wanting to share this with you so that you know that care coordination rates have a procedure code just like everything else in Medicaid. They have a unit and limit just like everything else in Medicaid. And there's a few different components to it. So for an application for a person to get a waiver or Community First Choice, which is another set of services. The first application is an initial application is reimbursed at 199.06. The support plan, annual support plan that you write is reimbursed at $853.14. That is one per year per person. And your case management for Community First Choice, if the person has only that program, is $364.01. For care coordination ongoing, for our waiver, Alaskans with a waiver, the monthly unit is $364.01. And the unit rates are the same no matter what waiver program or Community First Choice. So monthly units are always going to be the same. Annual unit for the support plan is always going to be the same. Initial application is always going to be the same. So we like to say to avoid planning to meet only the minimum requirements for care coordination. You really need to be able to fully serve each person on your caseload, and the person's needs do vary depending on their circumstances. And there is a geographic rate differential to people serving those living in rural communities. So the rates are a little bit higher. Will I need to certify? Will I need to re-enroll? Both individual care coordinators and agencies must apply for recertification. At the end of the first year of certification and varying 2 to 3 years thereafter, and the periodicity of it depends on the quality review of application and care coordinator performance. And the re-enrollment schedule itself is determined by Alaska Medicaid. How long does it take to get certified and enrolled? Complete first-time certification and enrollment process can take 3 to 6 months. You wouldn't be able to request reimbursement for care coordination until both processes are complete, and you cannot perform care coordination services before you are certified and enrolled. Where can I learn more about regulations that care coordination agencies and care coordinators must follow? Our entire set of Medicaid regulations, and in particular, care coordination agencies, are good resources. You would follow the provider conditions of participation and care coordinator conditions of participation, which are available on this website. This is a scan code for Senior and Disability Services Regulations page. What about using Harmony? Certified and enrolled care coordinators use Harmony, Senior and Disability Services data system. After you certify and enroll, You will turn in a user agreement and get training through the certification process. What other support is available? For care coordinator training, you can always email us at Senior and Disability Services SDS Training at alaska.gov. Our training academy online offers beginning and ongoing training and continuing education hours. We do offer monthly care coordinator info sharing webinars, and we do have a care coordinator liaison at Senior and Disability Services available at care coordination support at alaska.gov. We have weekly care coordinator open office hours with SDS on Zoom and weekly provider open office hours with SDS on Zoom. And those are all functions of the training and care coordination support teams here at Senior and Disability Services. And as a final reminder, you can always email us at sdstraining@alaska.gov. Thank you for viewing our presentation about becoming a care coordinator with the State of Alaska Medicaid, Home and Community-Based Waiver, and Community First Choice programs.